everyone, welcome to my next video regarding the protein binding of drugs. In last video we have discussed about what is protein binding of drugs and what are the significant effects of protein binding of drugs on its properties. When there will be protein binding of drugs, what all the properties of the drugs will vary. Those all we discussed in the last video. So today we will discuss about the proteins, plasma proteins involved in binding of drugs. So what all the proteins? Mainly there are so many proteins available in plasma, but some proteins are having significant role in binding of drugs and affecting its pharmacokinetic and pharmacodynamic properties of drug. Such proteins are albumin, alpha 1 acid glycoprotein, globulins, and we have lipoproteins. Mainly these four proteins bind with drugs and change the properties of the drug. Albumin. Albumin is the major plasma protein that constitute the total of the plasma protein present in the blood. So albumin has about 60%, it occupies about 60% of the plasma protein, and its molecular weight is of 65,000 Dalton, or otherwise it can be written as 65 kilo Dalton. So the molecular weight of albumin is of 65,000 Dalton. Now what is the significance of this albumin? This albumin binds the acidic drugs. So you can easily remember AA. Albumin binds with acidic drugs. So the most of the acidic drugs binds with albumin. Not only acidic drugs, some neutral drugs also gets bound with this albumin and affect the property of these acidic and neutral drugs. So what will be the concentration of albumin? Albumin's concentration is more in plasma, is about 4 gram per 100 ml. This is the normal concentration of albumin in plasma. But in some cases, like in pregnancy, during the last trimester, this will reduce up to 3.5 gram per 100 ml. Also this changes in case of inflammation and some tumors or malignancies, and then some diseases. Some diseases also affects the concentration of albumin present in the body. Further, it will affect the binding of drugs also. That is all about albumin. Now the next plasma protein, the most important plasma protein is alpha 1 acid glycoprotein, because the basic drugs bind with this alpha 1 acid glycoprotein. Its molecular weight is of about 40,000 Dalton. So the alpha 1 acid glycoprotein, its molecular weight is 40,000 Dalton, and its concentration in blood is about 400 milligram per 100 ml. See the difference. In case of albumin, its concentration is 4 gram, that is 4000 milligram per 100 ml. Whereas the alpha 1 acid glycoprotein's concentration is about just 400 milligram per 100 ml. Again, this also varies in some diseased conditions like nephrotic diseases, also hepatic diseases, and also during inflammation. The glycoprotein concentration also will be varied, and its significance is binding of basic type of drugs. So acidic drugs binds with albumin, basic drug bind with alpha 1 acid glycoprotein. And the third important plasma protein is globulin. Globulin. So we have so many globulins in this, like we have alpha 1, alpha 2, beta 1, beta 2 and gamma globulins. So globulin is of different types: alpha 1, alpha 2, beta 1, beta 2 and gamma. Alpha 1 glycoprotein alpha 1 globulin is also known as CBG or transcortin. What is the alpha 1 globulin is also known as CBG. CBG is corticosteroid binding globulin. So CBG is corticosteroid binding globulin and another name is transcortin. Now what is the significance of alpha 1 is binding of drugs like steroids. Steroids and the steroidal like drugs like vitamin B12, thyroxine will get bind with this alpha 1. So that's why it is known as corticosteroid binding globulin, because this globulin is responsible for binding of corticosteroids. So CBG binds the steroidal type of drugs. Now alpha 2, it is also known as ceruloplasmin. What is it? It is also known as ceruloplasmin, which is responsible for binding of vitamin A, D, E, K. That is fat soluble vitamins. Fat soluble vitamins gets bound with this alpha 2 globulins. Now what about the beta 2? Beta 2 is also known as transferrin. So it is known as transferrin type of plasma protein. As the name indicates, ferrin, so it binds all the iron compounds. That is ferrous or ferric type of compounds will be bound with this beta 1 type of globulin. Now this beta 2 is responsible for binding of carotenoids. Carotenoid type of drugs will bind with this beta 2 and gamma globulin, you might be knowing, it is also known as immunoglobulin, which is responsible for maintaining immunity in the body. When foreign bodies, that is antigens, enter into the body, these immunoglobulins secreted and binds. They are also known as antibody bind with antigens. So these immunoglobulins bind with antigen. So what is the importance of gamma globulin? They bind the antigen and it acts as a defense mechanism in the body. This is the different types of globulin that are responsible for binding of different types of drug. And lastly, we have lipoproteins. So lipoproteins also are of different types, that is HDL, LDL, VLDL and chylomicrons. HDL is high density lipoprotein, LDL is low density lipoprotein, very low density lipoprotein and chylomicrons. So these are all type of lipoproteins that are circulated in the blood, and these lipoproteins, which are the conjugated proteins, are responsible for binding of lipophilic drugs. So what for this lipoproteins are used? They are helpful in binding of lipophilic drugs. These are all the different types of plasma proteins that is present in the body and their importance in binding of different types of drug. So mainly albumin binds the acidic type of drug, and we have alpha 1 acid glycoprotein responsible for binding of basic type of drugs. Globulins, different types of globulins, that is alpha 1, alpha 2, beta 1, beta 2 and gamma. Alpha 1 binds steroids, alpha 2 binds the vitamin A, D, E, K, fat soluble vitamins. Beta 1 iron type of compounds. Beta 2 responsible for binding of carotenoids. Gamma immunoglobulins binds the antigens or foreign bodies. And lastly lipoproteins responsible for binding of lipophilic type of drugs. So we have discussed about the different types of proteins that are present in plasma, which are responsible for binding of drugs, thereby affecting the pharmacokinetic and pharmacodynamic properties of the drug. In my next video, we will discuss about the kinetics of plasma protein binding, and in further video we can discuss about the factors affecting